What if I told you that the vegetables you've been eating your entire life, the ones your doctor always encouraged you to consume, might actually be making your health problems worse? It sounds impossible, but for seniors dealing with blood thinners or arthritis pain, certain healthy vegetables could be silently sabotaging your health. Today, we're exposing the 4 common vegetables that might be secretly working against you and revealing what to eat instead. This information could literally change your life. Before we dive in, I want to make something crystal clear. Vegetables are generally incredibly healthy. However, when you have specific health conditions like arthritis or you're taking blood-thinning medications, certain vegetables can become problematic. Think of it as having the wrong tool for the job. A hammer is useful, but not when you need a screwdriver. What's truly shocking is how many doctors never mention these vegetable dangers to their patients. They'll prescribe medications worth hundreds of dollars, but won't tell you about the foods undermining those very treatments. That stops today. Let's expose these seemingly innocent vegetables that might be causing you more harm than good. Vegetable number 1, spinach. Let's start with spinach. Popeye's favorite and widely considered a superfood. For most people, spinach is nutritional gold, packed with iron, calcium, and antioxidants. But if you're taking blood thinners like warfarin, coumadin, this dark leafy green becomes your worst enemy. Here's why. Spinach contains astronomical amounts of vitamin K. Just 1 cup provides over 180% of your daily requirement. This might seem harmless, but vitamin K directly interferes with how blood thinners work. Think about it this way. Your medication is trying to prevent blood clots by limiting your body's natural clotting mechanisms. Meanwhile, vitamin K does exactly the opposite. It actively promotes blood clotting. It's like having your car's gas pedal and brake pressed at the same time. What makes this particularly dangerous is how dramatically spinach can throw off your medication's effectiveness. A 73-year-old viewer named Margaret shared how her INR levels, the test measuring blood clotting time, plummeted dangerously after she started adding spinach smoothies to her diet. Her doctor was baffled until they discovered her new health habit was actually putting her at serious risk for stroke or heart attack. Even more concerning is how quickly this can happen. You could have perfectly stable blood tests for months, then one big spinach salad later, your protection against clotting could be compromised within 24-48 hours. And the worst part? You won't feel any different until it's potentially too late. Safer alternatives. You don't have to give up greens entirely. Instead, try iceberg lettuce, which contains minimal vitamin K while still providing hydration and fiber. Cucumbers are another excellent option with almost no vitamin K. If you absolutely must have some leafy greens, romaine lettuce contains about 75% less vitamin K than spinach. Just remember, consistency is crucial. Whatever vegetables you choose, eat them in similar amounts regularly rather than binging one day and abstaining the next. Importantly, never stop your blood thinner without medical supervision, and always inform your healthcare provider about any major dietary changes. Vegetable number 2, tomatoes. Our second problematic vegetable is the tomato, a staple in countless dishes from Italian cuisine to American sandwiches and salads. But for the 54 million Americans suffering from arthritis, that juicy red tomato could be a hidden trigger for excruciating joint pain. Tomatoes belong to the nightshade family, a group of plants containing compounds called solanines and lectins that can trigger inflammatory responses in sensitive individuals. These compounds essentially act as the plant's natural pesticides, and while they protect the plant, they can irritate your body, particularly if you already have an inflammatory condition like rheumatoid arthritis. The connection between tomatoes and arthritis pain isn't just folklore. A 2011 survey published in the Journal of Nutrition showed that 38% of arthritis sufferers reported significant symptom improvement after eliminating nightshades like tomatoes. Even more compelling, a groundbreaking 2015 study found that lycopene, the antioxidant that gives tomatoes their red color, could actually increase inflammatory markers in people with certain genetic predispositions. Barbara, a 67-year-old retired nurse from Ohio, shared her story with us. After suffering from debilitating joint pain for years, despite taking prescription medications, she eliminated tomatoes from her diet. Within just 3 weeks, her morning stiffness decreased by 70%, and she could finally play with her grandchildren again. When she accidentally ate tomato sauce at a restaurant, her joints flared up within hours. Confirmation that wasn't just a coincidence. What makes tomatoes particularly deceptive is the delayed reaction. You might eat tomatoes for dinner and wake up the next morning with swollen, aching joints without making the connection. Over time, this consistent inflammation can accelerate joint damage and reduce your mobility. Safer alternatives. Replace tomatoes in sandwiches with avocado slices, which provide healthy fats that actually fight inflammation. For pasta sauces, try roasted red peppers, which, despite being related to tomatoes, seem to cause fewer problems, or create a tomato sauce using beets, carrots, and onions for that rich, savory flavor. Pumpkin or butternut squash puree can also create satisfyingly thick sauces without the inflammatory compounds. These substitutions not only avoid triggering arthritis pain, but also introduce anti-inflammatory compounds that may actively help reduce your symptoms. Vegetable number 3, broccoli. Our third vegetable might surprise you. Broccoli, the cruciferous vegetable celebrated for its cancer-fighting properties. While broccoli truly is a nutritional powerhouse for most people, it represents another serious danger for seniors taking blood thinners. Like spinach, broccoli contains significant amounts of vitamin K, about 110 micrograms in a single cup. That's over 90% of your daily requirement in just one serving. Those tiny florets might look innocent, but they're packed with the very compound that can render your blood thinners ineffective. What makes broccoli particularly problematic is that many people don't realize it belongs in the same high vitamin K category as spinach. In fact, a survey of blood thinner patients found that while 78% knew spinach could interfere with their medication, only 24% recognized broccoli as a potential problem. This knowledge gap has led to dangerous situations for many seniors. Take Robert's case, for example. After his heart valve replacement, he was diligently avoiding spinach, but decided to improve his diet by eating broccoli soup several times weekly. Within a month, his blood work showed his clotting factors were completely out of therapeutic range, putting him at serious risk. His doctor was puzzled until a dietitian identified the broccoli connection. The danger extends beyond just broccoli to its entire family of cruciferous vegetables. Brussels sprouts, kale, and cabbage all contain significant vitamin K. A single serving of kale contains even more vitamin K than spinach. The cumulative effect of these vegetables can dramatically alter how your blood thinner works. Safer alternatives. Cauliflower provides a texture and nutritional benefits similar to broccoli, but contains significantly less vitamin K. Bell peppers offer excellent crunch and vitamin C without interference. Carrots, squash, and corn are all vitamin K-friendly options that provide fiber and nutrients. Remember that vitamin K intake doesn't have to be zero. It just needs to be consistent. Work with your healthcare provider to determine what level works with your medication dosage and stick with it. Vegetable number 4, white potatoes. Our final vegetable villain is probably in your pantry right now, the white potato. This comfort food staple appears in everything from breakfast hash browns to dinner sides, but for arthritis sufferers, it could be silently amplifying your joint pain. Like tomatoes, white potatoes belong to the nightshade family and contain solanine, particularly in the skin and any green parts. This compound can trigger inflammatory responses in sensitive individuals, especially those with autoimmune-related arthritis. Even more concerning, potatoes contain calcitriol, a compound that can accelerate calcium removal from bones, potentially worsening conditions like osteoarthritis, where bone health is already compromised. A fascinating 2017 study in the Journal of Inflammation Research found that eliminating nightshades reduced inflammatory markers by up to 28% in patients with rheumatoid arthritis. When potatoes were specifically reintroduced, inflammation levels surged within 24 to 48 hours. Yet despite this evidence, most conventional doctors never mention this connection to their arthritis patients. Clara, a 71-year-old with osteoarthritis in her hands, shared how her joint pain mysteriously worsened every holiday season. After tracking her diet, she realized her increased potato consumption during these festive times, mashed potatoes, potato casseroles, and potato-based soups, directly corresponded with her pain flare-ups. When she switched to sweet potatoes and other alternatives, her holiday seasons became enjoyable again, rather than painful ordeals. The most insidious aspect of potatoes is their ubiquity in the American diet. They hide in processed foods, appear as thickeners, and are served alongside countless meals. This constant exposure can create a steady stream of inflammation that undermines even the most powerful arthritis medications. Safer alternatives. Sweet potatoes aren't just a delicious alternative. They actually belong to an entirely different plant family and don't contain the problematic compounds found in white potatoes. They're also nutritionally superior, with more fiber, vitamins A and C, and anti-inflammatory compounds. Other excellent replacements include turnips, rutabagas, or celery root for a satisfying starchy texture. Cauliflower, when mashed with garlic and olive oil, creates a remarkably similar texture to mashed potatoes without the inflammatory effects. These substitutions often become new favorites, even for dedicated potato lovers. So, we've uncovered 4 surprising vegetables that, despite their healthy reputation, could be sabotaging your health if you're dealing with blood thinners or arthritis. Remember, this doesn't mean these vegetables are unhealthy for everyone, just that you need to be aware of your body's specific needs. The power to improve your health is literally on your plate. Small strategic changes to your diet could potentially reduce your pain, improve your medication's effectiveness, and enhance your quality of life more than you ever imagined. Your golden years should be enjoyed with comfort and vitality, not pain and medication side effects. Before you go, remember that knowledge is only valuable when put into action. Try eliminating one of these vegetables at a time for 3 weeks if you suspect it might be affecting you. Keep a simple journal of your symptoms, and you might be amazed at the connections you discover. Your body has been trying to tell you something. Today, you've learned how to listen. If you found this information valuable, please hit the subscribe button and notification bell so you don't miss our upcoming video on the 5 best anti-inflammatory foods for seniors, where we'll show you what to eat for better health. Until next time, this is Name, wishing you vibrant health and pain-free living.